What if eating the proper nuts could do more than simply sat your hunger? What if they could genuinely protect your heart, mend your kidneys, reduce blood sugar, reduce nerve pain, and even naturally increase insulin sensitivity? The top 3 nuts for diabetics are revealed in this video, one of which has been dubbed a natural antioxidant powerhouse. A simple legume that functions as medicine in the body, this one isn't even a genuine nut. A third is a colorful green food that is full of substances that shield your heart, nerves, and eyes. You'll know exactly which nuts to eat, how much to consume, and how to enjoy them for the health of your diabetes if you stick with me through to the finish. Don't forget to read the final bonus diabetic advice regarding nuts. They might completely change the way you go about your everyday activities. Fox nuts are first on the list. Although they may resemble popcorn, fox nuts, also called macana, are a special kind of food that provides much more than simply a delightful crunch. Originating from water lily seeds, they have been utilized for ages in Ayurvedic medicine to promote fertility, digestion, and kidney function. The intriguing thing, though, is that fox nuts can be a wise addition to a diet that is diabetic-friendly. Fox nuts break down slowly and release glucose into the blood in a steady, regulated manner. Their glycemic index is approximately 37. For diabetics in particular, this is crucial because it helps prevent those unexpected increases in blood sugar that over time can harm organs, nerves, and blood vessels. About 95 calories, 1 gram of fat, 17 grams of carbs, 3 grams of protein, and 2 grams of fiber, roughly 7% of your daily value, are found in a 1 ounce, 28 grams portion of plain roasted fox nuts. This fiber is essential for promoting gut health, slowing down digestion, and extending feelings of fullness. Additionally, fox nuts include 400 milligrams of potassium per ounce, or roughly 8.5% of the daily need, which improves heart health, balances fluids, and lowers blood pressure. A significant factor because diabetes frequently coexists with high blood pressure and renal issues. Additionally, there is calcium, 2% daily value for strong bones and nerves, iron, 2% daily value, to carry oxygen in the blood, and magnesium, 7% daily value, to help the body handle insulin efficiently. Fox nuts are unique since they promote several aspects of diabetic health. Potassium benefits the heart and kidneys, while fiber and a low glycemic index help to balance blood sugar. Fox nuts and magnesium may help your body use insulin more efficiently by increasing insulin sensitivity. Flavonoids, camphorol, and alkaloids, antioxidants found in fox nuts, help combat free radicals, lowering inflammation that can harm the pancreas and make blood sugar regulation more difficult. According to one study, consuming fox nuts on a regular basis can reduce blood sugar increases after meals by as much as 18%, which is a significant improvement for diabetics. Additionally, fox nuts' special combination of plant components and amino acids has been demonstrated to help lessen sugar cravings. When attempting to avoid high-sugar snacks that can cause a blood sugar roller coaster, that is a significant plus. Let's dispel a widespread misconception. Fox nuts are seen by some to be little more than empty carbohydrates. It's just not true. Although they do include carbohydrates, the majority of them are complex carbohydrates, which means that their gradual breakdown helps to maintain stable blood sugar levels. Additionally, fox nuts contain resistant starch, a unique kind of carbohydrate that supports immunity, aids with digestion, and even lowers inflammation associated with diabetes by feeding the beneficial bacteria in your gut. Another fascinating truth is that fox nuts are a perfect snack for persons with special dietary needs because they are naturally vegan, gluten-free, and grain-free. For diabetics who prefer a crunchy snack without the high salt content, bad fats, or refined carbohydrates of chips or crackers, they're a great choice. What's even more intriguing is this. For diabetics, fox nuts can be a fantastic after-hours snack. It may indicate nocturnal hypoglycemia, or low blood sugar while you sleep, if you occasionally wake up feeling jittery or hungry at night. Overnight blood sugar drops can be avoided with fox nuts' mild, slow-release carbohydrate source, which gives you a consistent energy boost without raising blood sugar levels. Here's a tasty, easy way to eat them. Roasted fox nuts with spice. Grab a cup of unadorned fox nuts. Add a dash of black pepper, 1/4 teaspoon of turmeric, a pinch of sea salt, and 1 teaspoon of olive oil. Bake them for 10 minutes at 300 degrees Fahrenheit until they are crispy. In addition to being filling, this food lowers inflammation, promotes blood sugar control, and supplies nutrients like potassium and magnesium that diabetics frequently require. Aim for around 1 ounce to keep portions under control. It's about 2 little handfuls. Although fox nuts are good for you, eating too much of them can increase your carb intake. Therefore, it's recommended to continue using this portion size. The fact that fox nuts are technically seeds is a crucial warning. Therefore, if you are allergic to seeds or nuts, introduce them gradually and keep an eye out for any upset stomach. Additionally, avoid fox nuts from the supermarket that have been coated in artificial tastes, sugar, or salt. For the most health advantages, stick to plain, roasted, or mildly spiced varieties. Despite not being a popular food in the US, fox nuts are becoming more and more well-liked, and for good reason. In addition to supporting other aspects of diabetes health and possibly reducing sugar cravings, they provide a delightful crunch. Fox nuts demonstrate how a straightforward snack can help regulate blood sugar levels and safeguard the kidneys. However, did you know that there is a more well-known food that helps reduce A1C, reduce nerve discomfort, and reduce cravings while remaining reasonably priced? Next, nuts. Let's explore the science behind them. Peanuts come in second. One of the most underappreciated foods in the realm of diabetes is peanuts. They are often thought of as merely a salty treat or bar snack. However, peanuts are a nutritious powerhouse that can help control blood sugar, prevent problems from diabetes, and even lessen cravings for bad snacks. Let's examine the science behind why this underappreciated bean ought to be a part of every diabetic's diet. Let's start by discussing the glycemic index. With an incredibly low glycemic index of 14, peanuts virtually never raise blood sugar levels after eating. You can see why peanuts are such a wise decision when you compare that to white bread, which is about 70, or even a baked potato, which is about 85. The explanation is straightforward. Protein, fiber, and healthy fats found in peanuts slow down digestion and help release glucose into the bloodstream gradually. About 166 calories, 14 grams of fat, mainly heart-healthy monounsaturated and polyunsaturated fats, 4.5 grams of carbohydrates, 2.4 grams of fiber, 9% of your daily intake, and 7 grams of protein are found in a 1 ounce, 28 grams portion of dry roasted, unsalted peanuts. Additionally, peanuts include 210 milligrams of potassium, or 4.5% of daily intake, which can help regulate blood pressure. A 12% daily requirement of magnesium, 50 milligrams, is needed to promote insulin action. For healthy bones, take 18 milligrams of calcium, 1.4% daily value, and 1 milligram of iron, 5.5% daily value, to help carry oxygen in your blood. However, its effect on problems from diabetes is what truly makes peanuts a superfood for diabetics. Resveratrol, a naturally occurring substance found in peanuts, supports healthy blood vessels, lowers inflammation, and guards against harm to the heart, kidneys, and nerves. For instance, tingling, discomfort, or numbness in the hands and feet may result from diabetic neuropathy, a nerve damage brought on by persistently elevated blood sugar. Peanuts' resveratrol and other antioxidants aid in lowering oxidative stress, which harms nerve cells. Additionally, they increase blood flow by promoting the synthesis of nitric oxide, which relaxes blood vessels and lowers the risk of neuropathy and impaired circulation. Additionally, peanuts contribute to heart health, which is important because diabetes raises the risk of heart disease considerably. Peanuts' monounsaturated fats contribute to a better lipid balance that guards against atherosclerosis, or the accumulation of plaque in arteries, by lowering LDL, or bad cholesterol, and increasing HDL, or good cholesterol. According to one study, eating peanuts on a regular basis can cut LDL cholesterol by up to 12% and lessen the risk of heart disease by 20%. A remarkable advantage for such a cheap meal. A lot of people are surprised by this interesting truth. Peanuts aren't really nuts, did you know that? Although they are officially classified as legumes, like beans and lentils, their nutritional properties are more akin to those of tree nuts, providing comparable advantages for the heart and blood sugar. The insulin connection should not be overlooked. Peanuts contain magnesium, which improves how well your body's cells react to insulin, lowers insulin resistance, and aids in better blood sugar regulation. Additionally, peanuts' protein and fiber make you feel fuller for longer, which lowers your chance of experiencing blood sugar rises after meals. According to one study, using peanuts in meals can even lower blood sugar rises by as much as 18%. A strong effect for such a basic dish. By controlling hormones like ghrelin and leptin, which tell your brain when you're full, peanuts also help you manage your hunger. Because of this, peanuts are a fantastic tool for managing weight, which is a crucial aspect of diabetes therapy. Let's now address a prevalent myth. Some people believe that if you have diabetes, you should avoid peanuts since they are fattening. That is untrue. By lowering cravings and promoting sustained satiety, peanuts can actually aid with weight control when consumed in moderation. Processed peanut goods, such as sweet peanut butter or honey-roasted peanuts, can cause issues. The best peanuts are plain, dry roasted peanuts. This is a basic dish that is suitable for people with diabetes. Energy nibbles with peanut butter. Combine 1 cup of rolled oats, half a cup of natural unsweetened peanut butter, 1 teaspoon of ground flax seeds, a sprinkle of stevia, and a small amount of honey in a bowl. Refrigerate after rolling into little balls. You get a well-balanced combination of fiber, protein, and healthy fats with every meal, which helps to maintain blood sugar stability and satiety. Don't exceed 1 ounce of peanuts per serving to keep portions under control. That's about a handful, or about 28 peanuts. This quantity adds just the perfect amount of calories and carbohydrates while maintaining the proper dietary balance. Here's a potent tip for nutrient synergy. Peanuts work best when eaten with foods high in vitamin C, such as red bell pepper spears or orange slices. Vitamin C enhances oxygen transmission in your blood and increases energy levels by assisting your body in better absorbing the non-heme iron found in peanuts. This straightforward combination can have a significant impact, particularly for diabetics who may be at risk for anemia. A few things to be aware of. It's crucial to stay away from peanuts completely if you have a peanut allergy and substitute them with almonds or pumpkin seeds. Additionally, exercise caution when using store-bought peanut snacks. Avoid peanuts that have been roasted with honey or that have been seasoned with sugar, salt, or oils. Be sure to choose natural peanut butter that isn't sweetened or containing hydrogenated oils. To steer clear of trans fats and hidden sugars, read the label. I would like to know where you are watching from before we continue. Let's continue this discussion by leaving your city or nation in the comments section below. Let's move on to pistachios, the next nut. Pistachios come in third on the list. There is more to pistachios than just a crunchy, colorful snack. They are a nutrient-dense green powerhouse that helps maintain blood sugar balance, guards against problems from diabetes, and even enhances insulin sensitivity. Pistachios provide a special combination of fiber, plant protein, healthy fats, and potent antioxidants that help diabetics control their blood sugar levels and shield their bodies from the long-term harm that high blood sugar can bring. First, let's look at the glycemic index. With an extraordinarily low glycemic index of 15, pistachios raise blood sugar levels relatively gradually and steadily after consumption. Pistachios are a wise choice for diabetics because their calorie content is lower than that of the majority of fruits, grains, and even many other nuts. About 159 calories, 13 grams of fat, mainly heart-healthy monounsaturated and polyunsaturated fats, 8 grams of carbohydrates, 2.9 grams of fiber, 10% of your daily value, and 6 grams of protein are found in a 1 ounce, 28 grams portion of dry roasted, unsalted pistachios. At 290 milligrams per ounce, or 6% of the daily need, they are also a natural source of potassium. Magnesium, 7% of daily value, 30 milligrams per ounce. 135 milligrams of phosphorus per ounce, or 7% and 11% of the daily requirement, respectively. Additionally, vitamin B6, 30% of daily value, is 0.5 milligrams per ounce. A rare nutrient found in nuts that promotes the health of the brain and nerves. Additionally, pistachios offer trace levels of zinc, 6% daily value, and iron, 6% daily value, which promote wound healing and immunity. Pistachios, however, are more than just a simple food. For diabetics, they provide particular advantages. Together, the fiber, protein, and good fats slow down digestion, avoiding sudden rises in blood sugar after meals. Pistachios contain potassium, which lowers blood pressure and protects the kidneys, and magnesium, which improves how well your body uses insulin. Diabetics should pay particular attention to two areas. Eating pistachios every day can actually lower fasting blood sugar by as much as 10%, according to one study. Reduce triglyceride levels by 9% and LDL and bad cholesterol by 15%. A threefold advantage that safeguards your heart, blood vessels, and metabolism. Antioxidants like lutein, zeaxanthin, and gamma, a kind of vitamin E, are also abundant in pistachios and help shield the skin, nerves, and eyes from oxidative damage. A problem that can hasten the development of consequences such as retinopathy, or eye damage, and neuropathy, or damage to the nerves. For diabetics who have nerve discomfort, tingling, or poor wound healing, the high arginine and pistachio content increases the creation of nitric oxide, which improves blood flow and supports circulation. Come on, let's dispel a myth. Pistachios may be excessively heavy in fat for diabetics, according to some people. It's just not true. Although pistachios do include fat, the majority of that fat is beneficial fat, monounsaturated and polyunsaturated fats, which lower inflammation, lower cholesterol, and promote heart health. Pistachios are really among the few nuts that have been demonstrated to reduce blood triglycerides, a form of fat associated with heart disease and insulin resistance. This is an interesting fact. Pistachios are among the few nuts that naturally contain carotenoids, in case you were unaware. The same substances that give leafy greens and carrots their vibrant hues. These carotenoids, such as zeaxanthin and lutein, may reduce the risk of age-related macular degeneration and help shield the eyes from diabetic damage. This is a tasty meal that is suitable for those with diabetes. Chicken with a lemon herb pistachio crust. Combine 1 tablespoon of lemon zest, 1 teaspoon of dried oregano, a dash of salt, and a 1/4 cup of crushed pistachios. Olive oil should be applied to the skinless chicken breast. After pressing into the pistachio mixture, bake for 20 minutes at 375 degrees Fahrenheit. Due to its rich protein, heart-healthy fat, and fiber content, this dish is ideal for blood sugar stabilization. Try to limit your servings to no more than 1 ounce of pistachios. That amounts to about 49 pistachio kernels. All the advantages are present in this quantity without going overboard with calories or carbohydrates. This is a straightforward nutritional synergy tip. Pistachios can be paired with meals high in vitamin C, such as bell peppers or strawberries, to increase their absorption. This will enhance oxygen transport and energy levels, which are frequently impacted in diabetes. As a fast precaution, always select dry roasted, unsalted pistachios. Types that are salted or flavored may include too much sugar or sodium, which is bad for diabetics. Additionally, before including pistachios in your diet, speak with your doctor if you have a tree nut allergy. Extra advice about nuts for diabetics. First, when it comes to nuts, portion management is crucial. They are high in nutrients and good fats, but they are also high in calories. The sweet spot for the majority of diabetics is around 1 ounce per serving. That's about 2 tiny handfuls of fox nuts, 28 peanuts, or 49 pistachios. Overeating can introduce additional calories and carbohydrates, which over time may cause your blood sugar to rise. It's not about avoiding nuts, remember. The key is to consume them in proportion to your body. The best nut buying guide will be discussed next. Always read the ingredient label before making a purchase of nuts. Nuts that are basic, dry roasted, or raw and free of added oils, salt, sugar, or preservatives are the finest option. To avoid pesticide residues, go for non-GMO and organic products wherever you can, especially for peanuts. When purchasing peanut butter, look for a brand that simply contains peanuts and possibly a small amount of salt. No sugar, no hydrogenated oils, and no additives. Choose the in-shell type of pistachios. With addition to being less processed and fresher, shelling slows down the process, which aids with portion control. Additionally, while purchasing fox nuts, opt for unflavored, uncoated, and plain kind. Avoiding any artificial flavors, oils, or added sweeteners. Third, you may make your snack even more blood sugar friendly by combining nuts with foods high in fiber, such as cucumber sticks, apples, or carrots. For a filling, well-balanced mini-meal that slows down digestion and stabilizes blood sugar, try a dollop of peanut butter on celery or a handful of pistachios with cucumber slices. Fourth, think about taking a blood sugar test both before and 2 hours after consuming nuts. Since every person's body is unique, this easy test can help you learn how certain nuts, such pistachios, peanuts, or fox nuts, impact your blood sugar levels. Fifth, never choose nuts that have been salted or sugared, whether they are raw or dry roasted. Although flavored nuts, such as salted, honey roasted, or barbecued types, may look delicious, they frequently include unseen carbohydrates, fats, and salts that can cause blood pressure and blood sugar levels to rise. You can receive all the advantages without the extras if you stick to simple natural solutions. Sixth, keep in mind to carefully store your nuts. Healthy oils found in nuts can turn rancid if they are exposed to heat, light, or air for an extended period of time. To preserve freshness and safeguard those priceless nutrients, keep them in the refrigerator or in a cold, dark location. Lastly, incorporate nuts into your daily regimen. Eating nuts at least 4 times a week has been shown to enhance insulin sensitivity by 13%, lower fasting blood sugar by up to 10%, and lessen the risk of heart disease by 20%. Strong figures that have the potential to significantly impact your diabetes path. Healthy oils found in nuts can turn rancid if they are exposed to heat, light, or air for an extended period of time. To preserve freshness and safeguard those priceless nutrients, keep them in the refrigerator or in a cold, dark location. Lastly, incorporate nuts into your daily regimen. Eating nuts at least 4 times a week has been shown to enhance insulin sensitivity by 13%, lower fasting blood sugar by up to 10%, and lessen the risk of heart disease by 20%. Strong figures that have the potential to significantly impact your diabetes path. If this video was useful to you, please like it, share it with someone you think may benefit from it, and subscribe for more simple, science-based videos that will help you naturally manage your diabetes. And which of these nuts is your favorite? Let me know in the comments. How do you prefer to consume them? Continue to be curious and healthy, and I'll see you in the next.